Today's video about very important condition, triglyceride metabolism, that is fatty liver. Liver is not a storage organ of fat. Fatty acid synthesis and lipogenesis occur in the liver, but the triacylglycerol not stored in the liver. Normally, less than 5% of lipid is stored in the liver. That is also phospholipid. So, liver is not a storage organ of fat. Only 5% of lipid stored in liver, that also phospholipid. In the normal liver, triglyceride is presented in the form of small tablet. How it is presented? That 5% also presented in small tablet. But fatty liver, the tablet triacylglycerol occupy entire cytoplasm of hepatic cell. But fatty liver condition, here only 5% presented, that also tablet form. Here entire cytoplasm, this triacylglycerol is presented. Accumulation of fat in hepatocytes name is called as fatty liver. It is associated with inflammatory changes, leads to liver fibrosis condition, then finally it leads to chronic condition name is called as cirrhosis. So that inflammation leads to liver fibrosis, final condition name is called as liver cirrhosis. Then what is fatty liver? Deposition of excess triglyceride in hepatocytes. So in liver, high amount of triglyceride stored name is called as fatty liver. Fatty acid synthesis occur in liver. Fatty acid are packaged in the form of triglyceride. That is lipogenesis also occur in liver. This triacylglycerol also derived from chylomicron remnant. So what are the way fatty acid enter to liver? One is lipolysis process, second one is through chylomicron remnant. In fasting or starvation or diabetes mellitus condition, fatty acid are derived from lipolysis process. What are the condition? Fasting or starvation or diabetes mellitus condition, fatty acid derived from lipolysis process. That means triacylglycerol into fatty acid and glycerol. So here triacylglycerol is breakdown into fatty acid and glycerol. These fatty acid are transported to liver. Now this breakdown fatty acid transported to liver. Starvation liver can utilize the fatty acid for their energy. What is the condition? During starvation period, liver can utilize the fatty acid for their energy. Then triacylglycerol in the liver cannot stored. They secreted in the form of VLDL. So fatty acid during starvation period utilizing energy. The triacylglycerol in the liver cannot stored. They secreted. How they secreted? In the form of VLDL. Very low density lipoprotein is transported to peripheral tissue like adipose tissue and muscles. In this adipose tissue, triacylglycerol presentation in the form of VLDL. This one is breakdown into fatty acid and glycerol by the action of enzyme lipoprotein lipase enzyme, L-lipase, lipoprotein lipase enzyme. Fatty acid are taken by adipose tissue for storage for energy purpose in the muscles. So in lipolysis process through chylomicron, liver get fatty acid. Then this fatty acid is converted into triacylglycerol. Then this triacylglycerol is converted into VLDL form. Then with the help of lipoprotein lipase enzyme, it will transmitted to peripheral tissue. Next, when fatty liver occur, when increased synthesis of fatty acid, it is not utilized or not excreted through by organ. It leads to accumulation of triacylglycerol in the liver. When it will happen? Whenever it leads to increased lipolysis process, breakdown of triacylglycerol, more number of fatty acid transported to that liver. So here increased breakdown of triacylglycerol, more number of fatty acid transported to the liver, but the increasing fatty acid cannot oxidized through TCA cycle by the liver cannot be utilized, result in the accumulation of fatty acid in the form of triacylglyceride. So in the form of triacylglyceride excreted to VLDL, it cannot transported to peripheral tissue. Here lipoprotein lipase enzyme absent, so it cannot transmitted to peripheral tissue. This condition, the normal liver, the excess deposition of triacylglyceride in hepatocytes leads to fatty liver. So here transmitted means it don't cause fatty liver, but here it will deposited. Here not presented lipoprotein lipase enzyme, so this VLDL again transmitted to liver, so it will causes fatty liver. Next, types of fatty liver. There are two types of fatty liver. If it is take into chronic alcohol intake, okay, chronic alcohol intake, it is called alcoholic fatty liver. Any condition other than alcohol name is called non-alcoholic fatty liver disease. So two type is the alcoholic, second one is non-alcoholic fatty liver. This non-alcoholic fatty liver, various condition like morbid obesity, insulin resistant type 2 diabetes mellitus, then hyperlipidemia and hypertension. These are the condition causes non-alcoholic fatty liver disease. So what are the condition? Morbid obesity, insulin resistant type 2 diabetes mellitus, then hyperlipidemia and hypertension. Non-alcoholic fatty liver disease related to metabolic symptoms. The spectrum of non-alcoholic fatty liver disease less severe to more severe condition. First is hepatic steatosis, that is where the triacylglyceride or triglyceride is accumulated in the hepatocytes. If the triglyceride is accumulated, is associated with inflammation, this triacylglyceride associated with inflammation, it is called NASH, non-alcoholic steatohepatitis. And third, it is moved to severe condition, liver cirrhosis, when fat accumulation along with the inflammation. So when this fat accumulation, this condition fat accumulation, here it will causes infection. Together this condition, it leads to liver cirrhosis. So first condition, this one we already know, less severe to more severe. Here first condition, fat accumulated in liver, this condition name is called as hepatic steatosis. After that it will causes inflammation, non-alcoholic steatohepatitis. Then together this condition finally leads to severe condition, liver cirrhosis. So this is the spectrum of non-alcoholic fatty liver disease. What are the various causes of fatty liver? First condition, increasing synthesis of triacylglycerol. Second one is reduced utilization of fat. Third one is reduced removal of fat. So first, where increasing synthesis of triacylglycerol. Let's see the process. First cause is when high fat diet is consumed directly elevated triacylglycerol level. So we are taking high amount of fat diet means increasing that level of triacylglycerol. Even if the excess amount of carbohydrate consume also increasing TAG level. It also favor fatty acid synthesis and lipolysis of liver. So what are the condition? When we are taking high fat diet, then we will take high amount of carbohydrate. This one is favor for fatty acid synthesis and lipolysis process. It is associated with that condition of diabetes mellitus and starvation period. We know that a lipolysis process occur in these two conditions. There is increased lipolysis. Triacylglycerol is breakdown into fatty acid and glycerol. Fatty acid and glycerol. There is more mobilization of fatty acid to adipose tissue to liver. So number of fatty acid transported to liver is more than its capacity to utilization. So increased level of fatty acid then leads to increasing synthesis of triacylglycerol. So second condition, lipolysis, increasing synthesis of free fatty acid, then increased synthesis of triacylglycerol. Second condition, reduced utilization of fat. It is occur in chronic alcoholism. It causes two important mechanism. One is inhibiting fatty acid oxidation. Second one is promoting lipogenesis process. Then how alcoholic metabolism occur in our body? During this metabolism, there is increased NADH production. It leads to increased NADH or NAD plus production, NAD plus ratio. So more NADH. Okay, so here more NADH. Malate not able to converted into oxaloacetate. This malate is the intermediate. This one is the intermediate of Krebs cycle. It required for acetyl coenzyme A oxidation in Krebs cycle. No oxaloacetate means acetyl coenzyme A cannot utilize the oxaloacetate. That's why fatty acid that oxidation blocked. So fatty acid oxidation is blocked. So malate is cannot converted into oxaloacetate. So high alcoholism, chronic alcoholism leads to increased level of fatty acid in liver. It is accumulate in the form of triacylglycerol. Third condition, reduced removal of fat. It causes lipoprotein which carries endogenous triglyceride from liver to peripheral tissue is VLDL, and the formation of VLDL, apoprotein and phospholipid are required. So VLDL formation, apoprotein and phospholipid are required. After VLDL formation, this triacylglycerol is carried this VLDL from liver to peripheral tissue for utilization. In this case of protein energy malnutrition, there is deficiency of apoprotein. In the case of chemical poisoning, carbon tetrachloride, arsenic, lead and ethionine, they also inhibit protein synthesis. They prevent formation of VLDL. Then if choline, inositol, essential fatty acid, there are decreased lipoprotein factor. If they deficient, means phospholipid formation cannot occur. In all conditions, VLDL formation cannot occur properly and triacylglycerol, this one cannot removed from liver, so it leads to fatty liver. Let's talk about lipotropic factors. These lipotropic factors required for normal mobilization of fat from liver, and dietary deficiency of this factor prevent the risk of developing fatty liver. So next, dietary deficiency of this factor can result in fatty liver. There are various lipotropic factors like choline, inositol, methionine, vitamin E, selenium, vitamin B12 and folic acid. Choline and inositol, there are constituent of phospholipid. These phospholipid are integrate component of lipoprotein VLDL. If decreased choline and inositol, it leads to decreased VLDL synthesis and TAG export, which leads to fatty liver. How methionine is important? It is required for formation of lecithin. The active form of methionine, that is S-adenosyl methionine. It is a methyl group donor for formation of choline required for lecithin. So methionine also lipotropic factor. Then vitamin E and selenium, there is also lipotropic factor because of their antioxidant effect. Then vitamin B12 and folic acid, there are involved in the formation of methionine from homocysteine. Then essential fatty acid, there is decreased formation of phospholipids. Thanks for watching.